want to welcome you to the 10th Annual Healthcare Heroes Awards 2023. I think we can applaud that. When we started doing this, I was just a baby editor. Now I have some gray hair, so what can you do? But you should know, we do about 20 events at the magazine each year. And while all of them are celebratory, including this one, because of the endeavors of the heroes, there's a bit of emotion to this event, and it makes it special. It really does. And I think you'll see that as the heroes come up to speak, and the nominators come up to speak, you're going to see what kind of event this is. So I just want to say that. And, so now I want to introduce, actually, our first speaker. And her title is the Westchester County Deputy Director of Operations. I always want to get someone's title correct. And her name is Emily Saltzman. Please welcome Emily. Thank you.
Good afternoon, and thank you for giving me the opportunity to extend greetings to all of you on behalf of County Executive George Ladner. First, thank you to Westchester Magazine for having this event to honor our healthcare heroes. As the Deputy Director of Operations for Westchester County, I worked to manage the county's response to the COVID-19 pandemic. As we work to keep the people of this county safe while continuing to provide essential services, I thought often we are so lucky to have the healthcare partners we have in this county. And not just our outstanding hospitals and clinics, but our federally qualified health centers, pharmacies, urgent cares, nursing homes, home care agencies, medical and nursing schools, school nurses, laboratories, and countless others. There were so many heroes during COVID and continuing to this day. I do want to acknowledge two of my colleagues from the county who worked tirelessly, as we all did, to provide services and keep everyone safe. Our Health Department First Deputy Commissioner Renee Recchia and my colleague. While we did suffer tremendous loss during the pandemic, and every loss is a tragedy for a family, I believe that all of you helped to keep untold thousands of our residents healthy and safe. Your honorees today run the gamut from surgeons and administrators to peer specialists. A recognition that healthcare is provided by a wide range of individuals who represent essential building blocks in the foundation of community health. Thank you all for the essential work you do, and as we move forward from a life-altering healthcare crisis, one thing is clear. By fabulous individuals working together, we can create a healthier society for all. Thank you.
Montefiore Einstein. Also at the platinum level, Wegmans Hospital. And our gold sponsors, Elizabeth Seton Children's Center, and the Westchester County Office of Economic Development, and bronze sponsors, Specialty Surgeons of Connecticut, and our event sponsor, Westchester Talk Radio. I also want to thank Mulino's at Lake Isle for hosting us. Thank you, Mulino's, for all the food and the hospitality. Thank you so much. So our next speaker is someone that's on my staff. I couldn't put out the magazine that we do, the quality of the magazine that we do each month without her. If you thumb through any Westchester magazine, you'll see her byline all over the place on all sorts of articles, and one is better written than the next. So please let's welcome Associate Editor Michelle Gillens-Larkin.
Hello everyone. I'm very happy to be here, and I feel privileged to be in such highly regarded company. I spend a lot of time at the magazine writing about food and drink, but it have to be living under a rock to be unaware of all that is developing on Westchester's important and truly remarkable healthcare landscape. Among the biggest newsmakers of late, Westchester Medical Center is poised to construct a 5-story critical care medical tower. Doctors at White Plains Hospital are now performing open heart surgery, thrombectomies, and a 3rd cath lab is in the making. Northern Westchester Hospital recently opened 2 cath labs. Phelps has a new PET and CT scan imaging suite, and there's a new cancer center and a center for sleep medicine at New York Presbyterian Westchester. That's just the tip of the iceberg, obviously, and the list goes on and on. And it is without question, Westchester has become a destination for innovative, exceptional care. As we all know, none of this would be possible without the people, the caregivers and healthcare leaders behind every groundbreaking advancement and breathtaking achievement. Today, and for the 10th year in a row, we honor 13 of those amazing individuals, our 2023 healthcare heroes. This is how it all works. Each year, we receive anywhere from 80 to 120 nominations. We whittle that group down to the strongest 40 or 50 candidates, and then pass them along to our panel of 6 judges without revealing the nominee's name or current professional affiliation. Most of our judges, each an accomplished caregiver in their own right, have been with us since the beginning, and no doubt they are the heart and soul of this program. We thank them for their time and expertise. They are Dr. Robert Amler, Vice President of Government Affairs, Dean of the School of Health Sciences and Practice and Institute of Public Health, Professor of Health, Pediatrics, and Environmental Health Services at New York Medical College. Also, Dr. Sherlita Amler, Westchester County Commissioner of Health. Dr. Kathy Riley Fallon, foot and ankle surgeon at the founder and chairwoman of Heavenly Productions Foundation. Mary Godomsky, executive director at Montefiore Home Care. Dr. Jessica Zwerling, director of Montefiore Hudson Valley Center of Excellence for Alzheimer's Disease, professor of neurology at Albert Einstein College of Medicine, program director of UCNS Geriatric Neurology Fellowship, director of memory disorders at Mondale, associate director at the Center for the Aging Brain, and clinical director at Einstein Aging Study. And Dr. Nitin Gupta, pediatrician and owner and founder of Rivertown Pediatrics. Thank you to our judges. And now, for the 10th Annual Healthcare Heroes Awards. Presenting our first award is Stacy Petrower, President of New York Presbyterian Hudson Valley Hospital.
Good afternoon, everyone, and congratulations to all of the Westchester Magazine 2023 Healthcare Heroes. My name is Stacy Petrover. I'm the president at New York Presbyterian Hudson Valley Hospital. I've been there about almost 8 years now, and my life has been made exponentially better by having a colleague like Ellen Bloom. So I am delighted to Ellen has been a leader in the healthcare field in Westchester County for many years. Don't worry, Ellen, I'm not saying how many. And she is someone I am proud to work with and have worked with for the last 8 years, as I said. I could not think of anybody more deserving for this special honor because Ellen is truly everything, everywhere, all at once. In her current role as Director of Community Affairs for New York Presbyterian Westchester County, Ellen directs community outreach programs and implements grassroots initiatives for 3 of our NYP hospitals, New York Presbyterian Hudson Valley, New York Presbyterian Westchester, and New York Presbyterian Behavioral Health Center in White Plains. We have to reimburse you for your mileage, Ellen, I'm sorry. Throughout the pandemic, Ellen found new and innovative ways to stay connected with our communities, most especially through virtual communication, where her team developed engaging programs that were educational and supportive. Ellen was in frequent contact with our elected officials and community-based organizations, and soon understood that our communities were facing a significant food crisis. Food insecurity has been a cause Ellen has championed throughout her entire career, especially at New York Presbyterian. She serves on the executive committee for caring for the hungry and homeless of Peekskill, CHOP, and has actively led the annual food drives and garnered support from local elected officials who come out in force to demonstrate their support of CHOP. Working with Feeding Westchester in collaboration with our Sun River Health Federally Qualified Health Center in Peekskill, we were able to distribute 15,814 pounds of food to 250 unique households. The Mount Vernon Neighborhood Health Center, they also worked with us and they distributed 31,624 pounds of food to 144 unique households. 2 years into the pandemic, Ellen also quickly learned from school and community leaders in education about the struggles and anxiety and fears that resulted in self-isolation. So she created virtual programs with the Westchester Behavioral Health Center to bring their wealth of expertise to school leadership and families throughout Westchester County. She organized talks on anxiety, behavioral issues, including substance abuse, eating disorders, and other ways for parents to support this new normal. And she figured out a way to share this information in both English and Espanol to reach our most diverse communities. Recognizing that social isolation and access to medical care was a major issue for some of our communities during the pandemic, Ellen led the charge for NYP Hudson Valley and all of our other hospitals to provide laptops to our seniors and the technology education, which was the key to the program's success in both Peekskill and Mount Vernon. There are so many more programs that Ellen initiated and drove to fruition. It's just my honor to recognize somebody that gives her all every single day. Ellen, you are a true healthcare hero. I am just privileged to work with you. Carrie, Michael, Rachel, David, thank you all for being here. I don't know how you do it, you just do it. And I'm so proud to be your colleague and friend. Thank you and congratulations.
So overwhelmed. And Stacy, you're an amazing leader. And every day you inspire me to do better. I want to do better, as well as my whole team. I am so in awe of all of you sitting here. First, congratulations to my colleague from NYP, Joey Sutter, and all the honorees. I've read all your bios. I'm in awe of all of you, and I cannot believe I'm standing here with you. As we know, when you do what you love, it's a passion and you never work a day in your life. And I've been so fortunate over many years in healthcare to have that experience, especially in the last 8 years when I was so privileged to join New York Presbyterian Hospital. I started at Hudson Valley and then so fortunately joined another team under the leadership of my Vice President, Ann Sperling, my Corporate Director, Monica Hidalgo, and was able to expand to the other 3 campuses. I mean, how lucky am I? If you read my bio, you saw I was a candy striper at Lawrence Hospital. I can't believe I went back there, and it's just been so amazing. I grew up in Westchester County. I've had 35 years plus in healthcare. And 8 years ago, when I joined the top hospital in New York, I really knew what healthcare was all about. Not one day did anyone at Hudson Valley or New York Presbyterian say to me, make sure you go talk to people with insurance. Make sure you talk in those communities and not those communities. They actually told me, make sure you find out what the community needs and go out and figure out how to bring our experts, our services. I even have sponsorship dollars to even help further. This is an amazing organization. Not once did anyone ask me, oh, do they have insurance, by the way? Never, ever happened. This is the most incredible organization that is so selfless and cares so much about Westchester County and beyond. And this only happens with great leaders, and I am so privileged to be with great leaders and with wonderful colleagues. Westchester could not be covered without my wonderful colleagues, Lisa, Wendy, Alyssa, Susan, Tanya. The city would not be covered without Andrea or without Lauren. These are amazing people. I also want to express my heartfelt appreciation to the members of CHOP who are here today, Support Connection, and Thompson and Bender. They have given me support endlessly over all of these years to make sure we get it done. And I'm so glad to see you here today. My friends, my family, I'm so blessed to have everybody here. My brother Michael was born at Lawrence Hospital. And he's here today. Thank you, Michael, for supporting me. It means a lot for you to represent the family here today. My son David, a dedicated and compassionate physician, followed mom in healthcare, whose work in the field of pediatric cardiologist is saving countless lives and will make a huge difference as you continue in your career path. I'm so proud of you. You brought great joy to us with our grandson Charlie, my daughter-in-law Dahlia, and I'm so thrilled he's moving from St. Louis to Baltimore in a few months. We can try. My daughter Rachel, whose creativity, enthusiasm, and leadership as a camp director is helping countless children grow, learn, and develop. And thank you for bringing RN into our lives. I'm so proud of you both and all that you've achieved and all that you will achieve. So special thanks to my husband, Harry, who's and lived for 38 years. Never a moment of anything other than joy that he's brought me. He was there with the kids and the countless hours that I spent at numerous hospitals, making sure that things were happening, and Harry was there, bringing the kids everywhere they needed to be. So thank you all from the bottom of my heart. My friends are here, my very best friends from Tibby, Paul, Susan, Scott, Carol, and Bob. I can't thank you all enough. I can't even believe I'm standing here. So thank you all. Thank you.
Presenting our next award is Dr. Lisa Bardak, Chief Medical Officer at Optum Legacy Paramount.
Hello. Congratulations to all the healthcare heroes in the room and to everybody who's contributed to their successes, and thank you, Westchester Magazine, for entertaining us endlessly. I am going to keep my remarks a little bit more brief. I'm so excited to present the award of Healthcare Hero to someone who's very important to me, Dr. Caroline Mulino. I've known Caroline for 5 years. She's a colleague and a friend. I function as her mentor. She functions as my mentor. Caroline is a gifted internist. She's beloved by her patients, but she's also a very innovative, passionate, thoughtful, and a highly effective leader. In her role as medical director for adult primary care and population health, she has and continues to transform the way our physicians can effectively and holistically care for their patients during these challenging times. I could explain so many examples of how she's done that, but we would be here till tomorrow at breakfast. She has created a serious illness training program and continues to educate all of our physicians in the group on how to help their patients make end-of-life decisions. She has successfully launched several programs to improve the ways in which patients with chronic medical conditions such as diabetes, osteoporosis, and heart disease are monitored and cared for most effectively. Finally, she brings her love of literature, music, nature, and words to our Optum community as she leads our art and medicine program. It is with the utmost pleasure and my honor to give the award of Healthcare Hero to someone who is and will always be my hero, Dr. Caroline Mulino.
Thank you, Lisa. I have a little bit of a voice here because being a healthcare hero also means being a mom of son of COVID, so I apologize right now, and I will keep it brief, but thank you for those kind words. I can't imagine the journey that I started on would end here, or end continue here today, maybe that's another way to phrase it. I grew up here, this is home, and I'm here surrounded by family and friends and patients today. And one of the stories that reminded me why I'm here is 20 years ago today, my sister received a phone call from a former Mount Kisco medical group doctor telling her she had a very, very difficult diagnosis while I was a first-year medical student. And the care she received and the trajectory of her care inspired me to be a doctor who would always treat every patient like a family or a friend. And now here, standing here today, two of my patients came today with his family to thank me for the care that he provided as well. It was a complete surprise. And so, as we said earlier, when you do what you love, it's easy to be successful because we're the lucky ones. And I truly feel blessed and lucky to serve the community, that's my community, and to be able to give back so much, but also receive so much love in return. Thank you to everybody and congratulations.
Present our next award to Dr. Tracy Milligan, Professor and Chair of the Department of Neurology at New York Medical College.
Thank you very much. It's with great honor and admiration that I'm with you here today to acknowledge our amazing healthcare heroes, and in particular to recognize an exceptional individual who exemplifies what it means to be a healthcare hero and to lead with heart. Please join me in celebrating the remarkable achievements of Dr. Bill Etienne. As Vice Chancellor for Diversity and Inclusion Associate Dean of Student Affairs and Associate Professor of Neurology at New York Medical College, Dr. Etienne not only displays outstanding leadership in his field, but also has touched the lives of countless patients as a compassionate healer in their most vulnerable moments. However, it is
his unwavering dedication to enhancing diversity, promoting equity and inclusion, and fostering a sense of belonging that truly sets him apart as an exceptional leader. I noted in this magazine, honoring our healthcare heroes, it says, Dr. Mill Etienne has accomplished so much in his career, one might suspect the universe has granted him 36-hour days. I said, Mill, how did you do this? It's true. And I could really tell you a lot, but we don't have 36 hours today, so I'll highlight some of his really remarkable achievements, which really show his dedication to our community. Dr. Etienne, his impact reaches far beyond the walls of our medical college, but it's at the School of Medicine where he established the task force of anti-racism and anti-bias. By shedding light on the widespread health disparities, implicit bias, and microaggressions, Dr. Etienne is actively working towards creating a more equitable and just healthcare system. As part of his work in that area as well, he's spearheading a groundbreaking project which is highlighting the way that diseases manifest in people of color, and this has the potential to revolutionize healthcare by providing critical insights and improving outcomes for underrepresented populations. In addition, he sponsors the Medical Student for a Day program, which offers aspiring students from underrepresented backgrounds a glimpse into the world of medicine. He developed and currently teaches one of the most highly regarded courses for the fourth-year medical students called Multiculturalism in Medicine, which educates and empowers future physicians to embrace diversity and to serve diverse communities. He had a large role during the COVID-19 pandemic in which he addressed vaccine hesitancy while building positive community relations. And he was the keynote speaker at New York's first Black Men in White Coats, where he motivated over 300 middle and high school students to pursue careers in medicine and allied health professions. In addition to his numerous roles and all that he's doing in his 36-hour days, he also serves as immediate past president of the New York State Neurologic Society and as captain in the United States Navy. His commitment to excellence, both in his profession and in service to his community, is truly commendable. And I'd like you all to join me in acknowledging Dr. Mill Etienne as our healthcare hero.
Good afternoon, everyone. First, just thanks to Westchester Magazine and judges for this wonderful honor today. Thanks to my chair, Dr. Mulino, who is herself is a healthcare hero, outstanding leadership of our department. But what I wanted to say today is, you know, when we think about the word hero, we think about people who are going to be admirable, have shown courage, and have had accomplishments, which is what everyone shares today. We're getting these awards. And what I want to talk briefly about is the COVID-19 pandemic, which I heard is supposed to end today. And so, you know, one of the things that we see when we saw the pandemic come out, you know, we were all scared. It was something brand new. We had this virus that we hadn't seen before. It's brand new. We don't have any way to treat it yet. And it was a threat, right? That's what you see. When you see something you don't recognize and it's killing people rapidly. It killed my dad very early in the pandemic. What I'm really proud of, though, is what we saw particularly in Westchester County and other places around the country, was that we turned this threat into an opportunity. And it was an opportunity for us all to see the strength that we all have when we actually all work together. And that's what we did in Westchester. We had the Health Equity Task Force, where we had really all of our hospitals came together and said, this is our common enemy, and we have to defeat it. And we made sure to look for every nook and cranny for anybody, whether you wanted a vaccine or didn't want a vaccine. We're not going to have that debate today, but we made sure that those who were willing and who we could convince were going to get the vaccines. And we knew that by doing that, that's what actually allows us today to be here celebrating in person without masks, unless you want to wear one. And that's the strength of us all working together. And really, so we all came together, and I would say we're all essentially heroes, because if anybody chose not to support this effort, we would be in a different state. But I'm just going to say thanks to my chair, thanks to New York Medical College, Westchester Medical Center, wonderful organization. I've been very, very proud to work with, and I heard one of our earlier honorees talk about, not having to worry about their patient's insurance status. That is just horrible. You have to worry about it. Yes, insurance matters, and healthcare there is a business component. But yesterday I was at another event, and there I spoke about a child, a teenager, who died because he couldn't afford an $80 tooth extraction, and so this infection spread to his brain and killed him. That's what, when we talk about health equity, is that child should have had access to that really not even expensive care. But anyway, I know people have other things to do, but I just want to say thank you very much for this wonderful honor. I'm truly feel blessed and fortunate to be in your presence. Thank you.
Here to present our next award is Francis Bordoni, Executive Vice President for Ambulatory and Physician Services and Business Development at White Plains Hospital.
Good afternoon, everyone. I'm pleased to join you today in recognizing these remarkable healthcare leaders. I'm proud to be introducing one of our very close healthcare leaders from White Plains Hospital. But before I do that, I do want to congratulate Dr. Robert Fischler. And I'm going to say the title is all perfect because I came from Mountain. Surgeon-in-Chief, Chairman of Cardiothoracic and Vascular Surgery and the Department of Surgery. I got it, didn't I? At Montefiore High, as well as he is the Director of Cardiothoracic Surgery at White Plains Hospital. For being recognized with the Transformative Leadership Award today. Congratulations, Dr. Our next winner is Dr. Claudia Felberg. Dr. Felberg, unfortunately, is unable to be here today in person. She's traveling. But she shared with me that she's incredibly honored to be recognized. Well, I'm on the shorter side. She's incredibly honored to be recognized and has recorded a video to express her appreciation, which will be played shortly. Dr. Felberg has excelled as both a clinician and a leader in healthcare. Dr. Felberg has been with White Plains Hospital since 2002. Today, in addition to serving as the medical director for Scarsdale Medical Group, she is also the chief of pulmonary medicine and is also the vice president of the medical staff. During her career, she's treated more than 80,000 patients across the primary care and pulmonary practices. She is dedicated to her patients, respected by her colleagues, and incredibly passionate about her profession. She has contributed so much to the health of our community. We're so appreciative of her efforts, and I'm honored to accept this award on her behalf. Now here are some words from Dr. Felberg.
Thank you so much to Westchester Magazine for this honor. I am both proud and humbled to receive this award. Westchester is a wonderful place to live and to raise a family, as I have done for the last 25 years. It is also a great place to practice medicine. I joined Scarsdale Medical Group more than 20 years ago, and in that time, I had the pleasure of seeing the practice grow into the vibrant organization it is today, further strengthened by partnership with White Hospital in the last few years. I feel privileged to be in a career that I love, to provide care for patients here in our community, and to have the opportunity to build long-lasting relationships with them. I am a part of their lives in good times and bad. I have celebrated weddings, the birth of children and grandchildren, and even hundreds of birthday parties with them. And together, we have gone through this one pandemic. Delivering great care takes a team of talented and inspirational colleagues who I consider to be my heroes. While it is an honor to be recognized, I am also honored to be part of something so much bigger than myself. No one can do this alone. Scarsdale Medical Group has been caring for our community for over 6 decades, and White Plains Hospital for more than 130 years. It is this commitment to our community that makes working here just so special. I am really sorry that I cannot be here to accept this award in person, but please know how special it is to me. Thank you so much again for this recognition. Thank you to my partners at White Plains Hospital. Thank you for my partners and everybody that works with me at Scarsdale Medical Group. And also, thank you to my family who have always been there to support me and have gone with me in this wonderful ride. It has been an honor and will always be an honor to continue to work with all of you.
To present the next award is Bob Marone, radio host and current anchor for Westchester Talk Radio, owner of Radio Westchester, and director of public relations for Choice of New York.
First, I want to thank all of the doctors and medical professionals here. Congratulations for those awards. Thank you for keeping us alive and healthy for these last 3 years. Thank you very much. And a little bit of housekeeping. We're all sitting at these tables and we're all very comfortable and you have your food and everything. And behind it is always someone behind the scenes. And I just want to thank Jennifer D'Ambrosio. What's the guy? Okay, our next healthcare hero, like many people here today, doesn't like the limelight, like Jennifer, okay? And likes to give credit to his amazing staff at Choice of New York. And you will learn a little bit about it this morning as we talk about two very special people. His name was Guy Fessenden, and he was the executive director of Choice of New York. We advocate for the homeless, the physically disabled, the mentally ill, and we're going to underline that, and many other people in need. But first this. The great industrialist Henry Ford once said that a leader must have a hard head and a soft heart to be successful. Such is the case with Guy Fessenden. You know, when you think about the names of iconic leaders, how often do you think of compassion and kindness? In fact, you might say on the other end, and this is what he's done, a man who's taken an organization over a little more than 12 years, who's taken it from 3 employees and 20 clients, some of them patients, to where Choice of New York is today, 3,000 clients, 200 employees, officers throughout Westchester County, now moving into the Bronx, to help people. You would say that that probably takes a hard head as well. You see, Guy was a successful technology executive, making the money, living the life. But he had an inspiration. He had a daughter with near intractable schizophrenia, and it broke his heart. So Guy, shy as he is, decided to do something different. He says, I know. I will jog across America, Forrest Gump style, okay? I will jog across America, 60 different trips to raise awareness about mental illness. And when he came back, rather than going to make money, he applied for a job, and we have people here today, staff here, the board that interviewed him. He applied for a job at Choice of New York, well then Choice of New Rochelle, a little smaller, because he wanted to help people. He was driven by this urge, okay, to help people who, as he likes to say, are having the worst day of their lives every day. And what we do, just a little bit about what we do, and Guy will say more. And it's a surprise to no one, it should be, that he advocates for mental illness. But here's what else he does. We provide help and advocacy for the homeless, the physically disabled, recently incarcerated, and youthful offenders who need a better start in life, or again, as he likes to say, we get them on the worst day of their lives every day. Board meetings, though, are an example of the other side of God. Now, I've been on their board for about 7 years, and they threw me off because we need some money. You'll be in a meeting and someone will say, hey, we got a grant for $25,000. So how many people come? How does that work? How does that work? Or talk about a businessman. We own some of our facilities. We purchased one of our buildings, for example, rather than rented it because it would help our economic footprint. And in case we have downtimes, he likes to say, we could always sell people and help more people. This is an extraordinary man. What he's done in the last 12 years is nothing short of miraculous. So please, without further ado, it is my privilege to introduce Guy Kirk.
Wow, I want to meet that guy. Thank you, Bob, and thank you to Westchester Magazine for this wonderful recognition and an opportunity to chat a little bit about our organization. I wish there was more room behind the dais because I would like to have invited my 200 coworkers to be able to share this recognition and this honor. Because it takes a village to do what we do. We meet people who are street homeless, who are sick, who have legal problems, who can't negotiate the challenges and the bureaucracy of getting benefits without help. People, because they don't have a predictable income, have to resort to crime in order to get money for the basics that they need in everyday life, things that we all take for granted. And we sit down with these folks and we say, let's make a list. We'll call it a care plan, and let's knock that down one thing at a time. Gradually if we have to, faster if we can. And let's help you to be able to live the best life that you can live. Because everybody deserves dignity. Even the homeless guy that you see on the street. He's not a homeless guy. He's Fred or Don. He used to be an accountant, and then something went wrong. Then he lost his family. Then he lost his house. He lost his job. He lost everything. And that's where we meet them. And we help them as rapidly as we can, as effectively as we can, with an amazing staff of remarkable people to be able to live their best life. I am so proud of the people that I work with. And while I may be the figurehead to this, in a couple of minutes you're going to meet somebody who really has the rubber meet the road. We help 3,000 people a month in Westchester, street homeless, incarcerated within the past year, drug problems, alcohol problems, and we help them to be able to gradually get their life back. Enough people to fill the Westchester County Center every month. That's some pretty cool stuff. Nobody knows us. We're the best kept secret in Westchester, and we'd like to change that. So I want to introduce myself. I'm Guy. We're Choice of New York. You're going to hear from us. And I also know that I've only got 2 minutes. So I'd just like to wrap this up by thanking my coworkers, thanking my board for this wonderful opportunity. It's changed my life. It's changed the lives of many people. And thanks to Westchester Magazine for allowing us this wonderful opportunity. We appreciate you all. Hope you have a good afternoon.
To present the next award is Pat Tercey, CEO of Elizabeth Seton Children's Center.
Good afternoon. Good afternoon, everyone. I'd like to thank Westchester Magazine for hosting this beautiful day and for honoring our Elizabeth Seton Children's School Principal in Yonkers, Sharon Hurl, who is so very deserving of the title of Healthcare Hero. I also want to congratulate all of this year's honorees for their incredible contributions, going above and beyond every day to make our community healthier, safer, and stronger. And I also want to give a special shout out to Dr. Carol D. Filippo, who happens to be my physician. Passionate about equity, diversity, and excellence in education, Sharon Hurl is a pioneer and staunch advocate for the 169 children and young adults with severe medical complexity residing in Elizabeth Seton Children's Center, a highly specialized nursing facility. Our school principal for over 30 years, Sharon has led more than 100 educators and collaborates with over 300 members of the interdisciplinary team and resident and families to ensure that students receive the unique special instruction and related services necessary to learn, thrive, and experience the fullness of life. With Sharon's strategic vision, she modified her school program from a half to full day, promoting excellence and challenging learning experience. For children who are ventilator dependent and too fragile to attend school, Sharon boldly sought approval from the New York State Education Department to create grade level classrooms on individual units within our inpatient center, so children could learn while receiving high-tech medical nursing attention via safety monitoring devices with integrated alarm management systems, respiratory and life-sustaining equipment, complex medication administration, and nutrition. Sharon is passionate about providing our children and young adults with experiences that parallel the general education curriculum, from science fairs, graduation, school proms, community trips, to the Bronx View and Westchester Mall. And when a child was denied attending Cinderella on Broadway due to her ventilator, Sharon advocated the point that the manager added an electric outlet to make her dream come true. Sharon is fiercely determined to ensuring that all children can realize their academic potential in a safe environment, even under the most dire circumstances with COVID-19. While many schools were closing doors and learning opportunities, Sharon created the remote instruction program, transforming resident rooms into classrooms. And collaborating across disciplines after hours and on weekends. Likewise, working with our chief medical officer, she converted classrooms into COVID isolation rooms to keep all of our residents safe. And she didn't stop there. Following heart-wrenching state and federal regulations that prohibited family visiting in our inpatient nursing facility, Sharon began a family visitation program through the school after 6 unconscionable months of separation. The reunions were so joyful, a blessing to all our children and their families. Sharon is compassionate and empathetic, a mother, daughter, sister, and friend herself, who understands the importance of love, family, and faith. Sharon has built long-lasting relationships founded on dedication, kindness, and of course, the unique needs of our children and young adults. She leads with an open mind and heart, and holds herself accountable for the best outcomes for our students and staff. Sharon lives, of the words of our founders, St. Elizabeth Ann Seton, do your best and leave the rest to our dear God. Sharon's level of collaboration, humility, and true belief that no one is as smart as all of us empowers others yielding quick positive results and team goals. She mentors others in a way that makes people want to do their best and do more. For our children, young adults, and their families and our colleagues, Sharon is a servant leader and our true health hero. Sharon, you are an inspiration and so deserving this award, and I'm so proud to give it to you. Congratulations.
Good afternoon, everyone. Thank you to Westchester Magazine, and congratulations to all my fellow awardees. And thank you so much to all my many colleagues who took the time to nominate me, and who are here today. Thank you so much. I'm blessed to work with such wonderful people that are always focused on how to improve the lives of children and young adults with complex medical and learning needs. I can't think of a better way to spend each day than being part of a team that makes it possible for a child to accomplish things beyond what was expected and help a family to feel secure and comfortable leaving their precious child in our care. When I started my career at the school, I never dreamed that I would have the opportunity to be part of a state-of-the-art organization that is mission-driven and forward-thinking. My gratitude goes to our CEO at Percy, who has great faith in us and always encourages us to dream of the possibilities for our children, our young adults, and their families. I just want to take a moment to recognize a dear colleague of ours, Lori, and my father, who both passed away in February. I'm grateful to have worked side by side with Lori and to have her as a friend, and I'm also grateful that I was able to share my nomination with my dad. It's due to the boundless love and support of my family and friends that has made it possible for me to be part of Elizabeth Stevens Children. Thank you all.